President Moon Jae-in's healthcare reform plan is designed to enable national insurance to cover all treatments, that's excluding cosmetic procedures. It is an extremely ambitious goal, but how feasible is it? Our Jung-hee reports on how it's being received by doctors and patients.
President Moon Jae-in introduced his ambitious healthcare reform plan early this month.
올해 하반기부터 바로 시작해서 2022년까지 국민 모두가 의료비 걱정에서 자유로운 나라, 어떤 질병도 안심하고 치료받을 수 있는 나라를 만들어 가겠습니다.
The ultimate aim is to have no medical treatment left uncovered by the National Health Insurance, except for some cosmetic procedures. The National Health Insurance will start covering a number of services patients had to pay 100% for, like MRI scans, ultrasounds, and robotic surgery. The government will also cap medical spending based on households' yearly earnings, with the National Insurance Agency bearing the extra amount. The government plans to pour 30.6 trillion won, or $27 billion into this, with the money coming from the accumulated profits of national health insurance and the government budget. While this is expected to cut average medical expenditure by 18% and for low-incomers by 46%, it'll also raise Korea's national health insurance coverage rate to 70% by 2022 from the current 63.2%. Korean households bear almost 37% of their medical expenses, the second highest in the OECD following Mexico. The OECD average stands a bit below 20%.
The National Health Insurance covering all medical treatments sets a foundation for the government to prevent excessive spending on medical care. The public sector can set the prices for treatments and monitor if they're carried out properly.
Among those who welcome the government's new policies is the field of Korean traditional medicine, where many treatments weren't previously covered by the health insurance system. They say the new policies could raise demand for their treatments.
The current insurance covers Korean traditional medical treatments by 35% in large hospitals and by 47% in small clinics. Expanded coverage will make treatments affordable for more patients, as seen through the government's trial program for traditional therapeutic massages known as Chuna. Cost fell from the $26 to $80 range to the $4 to $10 range, and the clinic here has been seeing more patients.
Korean medicine is very effective in curing scoliosis, disc diseases, arthritis, and menstrual pains. But patients look for other options because of the financial burden. So we've been voicing opinions that health insurance should expand coverage of our treatments.
After a traffic accident, I first received treatment at Korean traditional clinics, but stopped later because of the high cost. But thanks to the test program, I could receive treatment again at a lower price, and I'm very happy about it.
Korea's dental field also welcomed the move, saying a wider range of people can receive dentures and dental implants. But hospitals are concerned that lower medical bills could make it hard to manage hospitals and provide quality care.
It's true that hospitals have been seeing losses in treatments that national insurance covers, and they've been making up for that loss through charging for treatments that national insurance doesn't cover. So the government will continue communicating with the medical field and make sure to set appropriate prices for treatments.
Also, the healthcare reform could result hurting small clinics.
Patients don't really go to large hospitals due to the high cost. But as the national health care expands coverage for all treatments, patients will start to prefer large hospitals over small clinics. The government seems to know this, but a detailed plan on this part isn't yet given.
Many people welcome the proposed changes, as Korean healthcare hasn't been reformed for decades. But with some critics saying the target coverage rate of 70% is still lower than desired, the government has lots to do to tweak the reform and turn it into reality. Jung-hee, Arirang News.